How to cope with restless leg syndrome. If you have a tingling sensation or a constant urge to move your legs, especially at night, you may have restless leg syndrome. RLS can severely disrupt your sleep. You will need a family doctor, iron supplements, folate supplements, magnesium supplements, friends and family, exercise, warm baths, massages, hot and cold packs, books, puzzles, knitting, and a TV. Optional, bedtime stretches. Step 1. Work with your doctor to see if you have underlying conditions like Parkinson's disease, diabetes, anemia, kidney disease, or are pregnant. Medicines commonly used to treat Parkinson's are often used to lessen the effects of RLS. Some pregnant women in their last trimester experience RLS, but symptoms usually go away within a month after delivery. Drugs used to treat RLS are harmful to pregnant women. Step 2. Determine if you have any nutritional deficiencies. Supplementing your diet with iron, folate, and magnesium may give you some relief. Step 3. Cut back on caffeine, alcohol, and tobacco. These stimulants can put RLS into overdrive. Step 4. Tell your family and friends about your condition so they know what to expect and can offer support. Step 5. Work out regularly and stretch daily. Yoga and Pilates are great techniques to incorporate into your exercise regimen. Stretching before bed is a great way to reduce RLS symptoms, but cardio or weight training too close to bedtime can aggravate your condition. Step 6. Take warm baths or massage your legs for temporary relief, along with alternating between hot and cold packs. Step 7. Find an activity that occupies your mind during tough times, like reading a book, working on puzzles, knitting, or watching TV. There's no cure for RLS, but researchers are working on new treatments every day. Did you know restless leg syndrome is hereditary?
How to control asthma attacks. Limit asthma attacks by learning how to anticipate and prevent them. You will need a medical doctor, knowledge of symptoms, warning signs, and triggers, preventive measures, and a peak flow monitor. Step 1. Recognize asthma symptoms, which include wheezing, breathing problems that become worse after physical activity, coughing fits, especially at night or when lying down, and colds that last more than 10 days. A family history of asthma increases your chances of having the disease. Step 2. If you suspect you have asthma, have a medical doctor evaluate your condition. You may benefit from daily medication to prevent attacks. You may also need to carry a quick reliever, like an inhaler, in case an attack occurs. Contrary to what some people think, cough medicine doesn't relieve asthma symptoms. Step 3. Learn to recognize the warning signs of an attack so you can treat it before it becomes severe. Common symptoms include chest tightness, coughing, spitting up phlegm, wheezing, and a whistling noise when you breathe. An asthma attack causes airways to swell and become inflamed, and the muscles around the airways to contract, causing your breathing tubes to narrow. Step 4. Try to avoid or limit your exposure to things that spark attacks. Common triggers include pollen, mold, dust, animals, tobacco smoke, smog, strenuous exercise, certain cleaning products, perfume, cold air, and aspirin and other pain relievers. To reduce contact with dust mites, use mattress and pillow covers, don't use down bedding, and don't sleep with stuffed animals on your bed. Step 5. Get a peak flow meter, a device that measures airflow from the lungs. Blow into the meter when you're not having an attack to determine your personal best reading. You can compare the number against future measurements, helping to confirm when an attack may be imminent and determine if your medicine is working. Step 6. Go to the emergency room if you can't speak more than short phrases, are straining to breathe, or if your peak flow reading is less than 50% of your personal best. Did you know? About 20% of Summer Olympics athletes have asthma, according to research.
How to handle a dental emergency. Sports injuries, falls, and accidents can all lead to a lost filling, cap, or other dental emergencies. Here are some temporary first aid measures to hold you until you get professional treatment. You will need warm water, a cold compress, your dentist, milk, and dental floss. Optional, an emergency professional. Step 1. Clean and apply a cold press to the injured area if you bit your lip or tongue. Seek emergency treatment if the bleeding does not stop. Step 2. Rinse your mouth with warm water if you break a tooth. Apply a cold compress and call your dentist. Step 3. Apply a cold compress to your jaw if you think you broke it. Seek professional treatment immediately. Step 4. Rinse a dislodged tooth in water if it is dirty. Place it in a cup of milk and take it to your dentist. Step 5. Rinse your mouth with warm water if you have a toothache. Try using dental floss to remove any material caught between teeth. If the pain persists, see your dentist. Did you know male llamas get their canines, also known as fighting teeth, between 2 and 3 years of age, and female llamas get theirs between 4 and 5 years of age?
How to handle heart palpitations. Palpitations are heartbeat sensations that make you feel as though your heart is racing. Once your doctor has ruled out a serious medical condition, take the steps described here to control the condition. You will need a record of your palpitations, stress reduction techniques, a healthy diet, exercise, sleep, and blood pressure and cholesterol monitoring devices. Optional: deep breathing exercises and muscle relaxation techniques. Seek emergency treatment if palpitations cause loss of consciousness or are accompanied by shortness of breath, chest pain, unusual sweating, dizziness, or lightheadedness. Step 1. Keep track of how often you have palpitations, when they occur, their duration, your heart rate when you experience them, and how you felt at the time. Determine whether they are associated with certain activities, events, or feelings. Consult your doctor immediately if you suddenly experience new or different palpitations, or if you are at risk for heart disease when they occur, if you are experiencing frequent extra heartbeats, or if your pulse is greater than 100 beats per minute. Step 2. Reduce your stress and anxiety levels. Use stress-reducing techniques, such as meditation or Tai Chi, to prevent palpitations. If palpitations occur, use deep breathing and muscle relaxation techniques to reduce their severity. Step 3. Cut back on caffeine and do not smoke. Be careful about using decongestants that contain pseudoephedrine or phenylephrine. Step 4. Maintain a well-balanced, low-fat diet. Eat enough to avoid low blood sugar levels and drink plenty of fluids. Step 5. Exercise regularly and be sure to get enough sleep. Step 6. Monitor your blood pressure and cholesterol levels to keep them under control. Did you know? Before 1900, when walking was the most common means of transportation, very few people died of heart disease.
How to know if your finger is broken. The fingers are the most frequently injured part of the hand. Injuries range from simple bruises to broken bones and dislocations of joints. Here's how to know if your finger is broken. You will need an awareness of pain, an awareness of swelling and lack of mobility, an awareness of bruising, and an urgent care facility or emergency room. Optional: an awareness of numbness. Step 1. Try bending the injured finger immediately after the injury. A fractured finger is usually painful, although the pain may be dull. Step 2. Note whether the hurt finger becomes swollen and red and is difficult to move shortly after the injury. This is a sign that the finger is broken. If the swelling becomes pronounced, numbness may occur due to nerve compression. Step 3. Watch for bruising, which could signify severe fractures or jammed fingers. Step 4. Go to an urgent care facility or emergency room if you experience these symptoms and are in a lot of pain. The doctor will take an X-ray to evaluate the positions of any sprained or broken finger bones. Did you know? Fingers are made up of ligaments, tendons, and 3 bones called phalanges. There are no muscles in them.
How to prevent ear infections in children. Most ear infections start as a cold and progress to an infection of the middle ear caused by bacteria. You will need breast milk, clean hands, and immunizations. Step 1. Avoid places with cigarette smoke, especially when you are with your children. Ear infections occur more often in children exposed to cigarette smoke. Babies and young children with ear infections may pull at their ears, have a fever, or have trouble sleeping. Step 2. Limit the use of large childcare facilities where there is an increased risk of catching a cold. Step 3. If you can, breastfeed your baby for the first 6 to 12 months. Breast milk has antibodies that aid in reducing ear infections. Step 4. Avoid having your child going to sleep while sucking on a bottle or drinking while laying down. Step 5. Wash your hands regularly and avoid touching the nose and eyes with germy hands. Step 6. Have your child immunized. Did you know? Most ear infections occur in children between the ages of 6 months and 2 years.
How to take your own pulse. Follow these simple steps to test your pulse and measure how quickly your heart is beating. You will need a watch with a second hand. Step 1. Rest quietly for 10 minutes to take a resting heart rate measurement. If you are testing your active heart rate, test after activity. Step 2. Turn your left arm palm up and place the first 2 fingers of your right hand on the inside of your wrist, just below your thumb. Press gently to feel your pulse. Your carotid artery on the side of your neck may give a stronger pulse. Step 3. Count the number of beats you feel over 30 seconds. Double that number for the number of beats per minute. The average resting heart rate for an adult man is 70 beats per minute and 75 beats for an adult woman. Step 4. Keep your heart pumping and your heart rate low with exercise and a healthy diet. Did you know? Your heart beats more than 2.5 billion times over the course of a 70-year lifetime. How to treat burning mouth syndrome. Have you ever experienced an unexplainable burning sensation in your mouth, throat, gums, or tongue? You may be experiencing symptoms of burning mouth syndrome. You will need a dentist, alpha-lipoic acid, hot pepper sauce, anti-anxiety and antidepressant medications, and 2 tablespoons of milk of magnesia. Step 1. Visit your dentist if you experience burning in your mouth, throat, or tongue. Typically, symptoms are mild in the morning, but gradually worsen as the day progresses. Step 2. Use alpha-lipoic acid, or ALA. The burning sensation may be caused by damaged nerves. ALA neutralizes and prevents further damage to nerve cells. A new form of treatment involves placing an electrode on the affected nerve to block pain receptors. Step 3. Rinse your mouth with water and a few drops of hot pepper sauce 4 times daily. After a few days, the mixture will start to neutralize the burn. Step 4. Talk to your doctor about anti-anxiety and antidepressant medications. Researchers have found a strong correlation between people with the syndrome and disorders such as anxiety attacks and obsessive-compulsive disorder. Relaxing the nervous system may help calm the burning. Step 5. Mix water with the milk of magnesia and gargle twice daily. Coating the tongue with milk of magnesia stimulates touch and taste receptors, which inhibit pain nerve fibers. Did you know 70% of people who suffer from burning mouth syndrome also suffer from migraines?
How to recognize the symptoms of appendicitis. Appendicitis occurs when your appendix becomes inflamed and fills with pus. Watch out for the symptoms. You will need a doctor. Step 1. Know that pain may vary depending on the person's age and the position of the appendix. Pregnant women and young children may experience pain in different places. Step 2. Know that pain typically starts around your navel and then shifts to your right abdomen. Step 3. Be aware that pain may get worse if you walk, cough, or move. Step 4. Recognize as symptoms a loss of appetite, nausea, swelling of the abdominal area, and a high fever. Step 5. Be aware that diarrhea with gas, painful urination, and constipation can occur. Step 6. Contact a doctor if you experience any of these symptoms. You may have appendicitis. Did you know? Appendicitis will usually occur when a person is between the ages of 10 and 30.